back to Better Kansas City. It's the power of regenerative medicine, functional rehab, and chiropractic care, and the science of stem cell technology. We have Dr. Bruce Rickby and Dr. Jim Wiley of Bridge. I don't know, I can never pronounce that word the right way. Integrative Medicine are back to continue the conversation we began last week. Dr. Bruce, you were here last week, and we kind of got an introduction to your practice. Talk a little bit about that, and I'll go ahead and introduce your partner here as well.
I was amazed at how many of your viewers really do need something for chronic pain, and we were bringing science and stem cell technology together, and we got a lot of replies for that, so I thought I'd bring back the other 3/4 of my brain, and they could meet Jim Wiley.
All right, well, Doc, it's good to meet you and a pleasure to have you here today. There's just so much out there when it comes to modern medicine. It's hard to keep track of it all, and a lot of the times it seems like the patient gets left out of that. Kind of talk about how that's not the way your guys practice.
Yeah, absolutely. So the advancements of medicine are tremendous.
Yeah.
But there's a couple areas where we have recognized that there are some failings. One of them is in treating chronic pain, chronic degeneration or injury like that. Opioids was used for a lot of those, and that led to a crisis, and they're dangerous and they're addictive, and so one of the things that we pledge to do at Bridge is not use opioids. Okay. The second piece is, and everybody's had this experience, you go to a doctor for a particular condition, it's this doctor and that doctor and that doctor, and they're great doctors, but what's the chance of them actually communicating and talking together? So what we did at Bridge is we put all of those doctors, all the way from front desk, all the way down to the nurse practitioner, the rehab techs, the chiropractors, our medical staff. We all work together and talk about you.
Yeah.
You are the major focus of our communication.
So can we step back and talk a little bit about how opioids were prescribed a lot for that chronic pain? What is your guys' approach then to treating chronic pain in some of your patients? I'm sure there's probably a bunch of different ways that you guys go about doing it, but just what's something that people can expect to get treated by when they come see you?
It's a great question. So you have to look at the underlying cause of that pain, and oftentimes that leads to something that's just functionally not working like it's supposed to. So part of our initial consultation, which you would get as you came into our office, would be that in that examination is a functional evaluation. We break down exactly what's causing the problem, find that, and then direct our treatment at that solution.
Okay, so whether it's we talked about last week, whether it's a sports injury or maybe it's just something developmentally flawed, not saying that everybody's perfect, but just stuff that different ways that you can go about treating those different injuries. Interesting.
That's right.
And then again, going back to the whole teamwork aspect of your practice, talk a little bit about how the patient is part of that team.
Yeah, central.
Yeah,
right? That's exactly right. It's central. You are the person that we concentrate on. And so, as great as regenerative medicine is, and it is great, and stem cell technology, it will only go so far. The thing that has to happen then after that is we really do have to focus in on you, involve you in activities that are regenerative, that help you heal and grow.
Yeah.
And when we combine those things together and with the power of the team, that collaboration, that synergy that happens when we focus on getting you better and getting your life back, it's amazing.
And it's not just a one-shot fix-all type of deal. It's that teamwork approach, putting together that plan, but then sticking to it, right?
Absolutely. That's how you get a lasting solution.
Yeah.
When you get involved and you learn about all those activities, and exercise is great, but targeted exercise is even better.
Yeah.
When we start to target those areas, and then we teach you the tools that you can have for a lifetime, that's how you get the lasting solution.
Awesome. Well, what else do we need to know here before we go into the big game this weekend? I know you guys are going to be watching it. Do you have any predictions or anything that we should be maybe some targeted calisthenics before we get to sitting on the couch for all Sunday?
Nervous, but we'll win.
Okay. All right. Well, you heard it here from the doctors, Dr. Bruce and Dr. Jim. Thank you guys very much for being here today. You actually have an opportunity to have lunch with the doc. Start time today at noon. The location, Granite City Food and Brewery up in Zona Rosa. For more information, call 816-203-0258 or go online to Bridge Integrative. Why can I not say that word?
We'll give you another chance.
And you know what? Maybe you guys should come up with the therapy for me to be able to say it. All right, bridgeintegrativemedicine.com/events. Gentlemen, thank you so much for being here. We do appreciate it. I'm going to go take a nap.